I welcome you to this online tutorial. We are still on biochemistry of homeostasis, and we are looking at acid-base balance. So now we'll be discussing at disturbance in acid-base balance. And this disturbance in acid-base balance are grouped into two. One, group into acidosis and alkalosis. Okay, they are grouped into two. One, acidosis, and we say acidosis, it is due to accumulation of acid and the blood pH is below 7.4. So it is below 7.4 to show that what? It is in the state of acidosis. And that is our one. Then two, and number two is what? Alkalosis. And then we say that it's accumulation of alkali that make the blood pH to be above 7.4. That shows that 7.4 is a normal range. So now we are going to differentiate using acidosis and alkalosis to differentiate very important keywords here that will help us to understand this better. Acidosis and alkalosis, in which I have explained to you earlier, when it is more or less of bicarbonate, we can refer to as what? Metabolic acidosis or metabolic alkalosis. But when acidosis or alkalosis is more or less in carbonic acid, listing carbonic acid, we can refer to as what? Respiratory acidosis or respiratory alkalosis. Okay, so the difference here is bicarbonate and what? Carbonic acid. Okay, that show whether it is what? Under a metabolic or a respiratory acidosis or alkalosis. So, and this disturbance can be acute, means immediate, temporal, or chronic, means over a long period of time. And in such a case, the body always attempt to normalize the acid-base ratio. By how did the body attempt to normalize the acid-base ratio? Our bicarbonate, hydrogen carbonate, is a conjugate base, while H2CO3 is our carbonic acid. So the body are trying to normalize this a base to this acid ratio. By what? By removing CO2. Okay, why is removing CO2 by the lungs? Is blowing off the carbonic acid. Is blowing off the carbonic acid by removing the CO2 by the lungs. And again, the kidney also decide to reabsorb bicarbonate. The kidney will decide to reabsorb bicarbonate and remove or excrete the hydrogen ions from the system. That happens in the kidney. So if the normal ratio of this bicarbonate and carbonic acid is restored, then acidosis and alkalosis is what? Compensated. Okay? So that is the brief of what we are about to discuss. And it's good that you listen. Now we go into metabolic acidosis proper. We say it is the most common acid-based disturbance. And it's in the condition that happens in the plasma or bicarbonate level that is low. So when the plasma bicarbonate level is low, okay, when we say bicarbonate, we are talking about the alkaline. If it is low, means the body is more of what? Acid, and we refer to it as what? Metabolic acidosis. We are using the word metabolic because metabolic, just as a layman understanding from your secondary school that we call we say digestion. But for this we call it metabolic because it is more of forming, something has been formed and then with synthesis and then degradation. That's why we are referring to it like that. So in such a case from food, we refer to as what? Metabolic acidosis. And now we need to explain further excess production of this acid which occur in diabetes mellitus. Okay, so in such production of excessive acid, it happens in diabetic patients, starvation, phenylketonuria, and marble serial urine disease. Okay, and even in the case of when there is this excessive acid in the body under intensive muscular exercise, it can also lead to accumulation of lactic acid. When you are talking about lactic acid, like so many of you that each time you visit your toilet and the stomach is gassing, the way you are seeing it and you are hearing it, all that happens is a result of accumulation of lactic acid in your body that you are trying to release out. Okay? And such a condition we refer to as what? Lactic acidosis. It's a good example of you gassing in your toilet. It's a very good example of such acidosis. Okay? And I want you to listen carefully. We proceed. Then B, injection of mineral acid. Okay? Your body is made up of a lot of acid, hydrochloric acid in the system. You have been eating a lot of acid already be in the body, and the body is trying to balance that, and you are still injecting mineral acid. Food high in acidic content, that also will lead to excessive acid in the body. Okay? And also drugs, administration of certain drugs. Okay? See, loss of bicarbonate. Bicarbonate is an alkaline base. You lost it to vomiting, diarrhea, or loss of pancreatic fluid, okay, that is in the pancreas of the small intestine. You have lost it. Or all that one can contribute to metabolic acidosis, or decrease hydrogen ion secretion in kidney, whereby hydrogen should have been hydrogen ion secretion in the kidney. It should have been released out of the body, but it is not released out of the body. It's still accumulated. And this hydrogen ion is dangerous to the body. It is make the body to resort to a high acidic content. It is very, very important that you release out of the system. But if it remains like a case like a nephritis, it can result to metabolic acidosis. E, increased elimination of bicarbonate by the kidneys is also occurred, and this can happen in renal failure. So in the case of renal failure, people that have kidney disease, okay, what happens here is that what? Increased elimination of what? Of a hydrogen carbonate, means the body is releasing this hydrogen carbonate, this alkaline, that balance the acidic content and the alkaline content in the body. The body has released everything because of this renal failure. So it will be dangerous to the body. So that's what we are talking about. And so now we are proceeding to what? Metabolic acidosis. How is it compensated? Metabolic acidosis is compensated by the lungs and the kidneys. Okay? So how does it happen? There will be an increased elimination of CO2. Remember, when CO2 is released out of the body through respiration, you are blowing up the carbonic acid, okay, in form of CO2. That is what it means. And carbonic acid content diminishes. Why? Because it is the pressure CO2 and water that gives you carbonic acid. So when you are releasing CO2 out of the system, then it will diminish carbonic acid. That's how it is what? Eliminated. We are talking about how can it be compensated by the lungs. So that is how it is compensated by the lungs. Now, how is it compensated by the kidney? Listen carefully. The renal compensatory mechanism involves expression of what? Of more ammonias and isophosphate. When we say ammonias is released out of the body, ammonia is not released directly. You know, in the lumen, ammonia combined with what? Hydrogen. Ammonia combined with a hydrogen ion, which is the protons, hydrogen ions in the lumen, to form ammonium, which is released out of the body. That's how to remove ammonia from the body, to compensate the kidneys. This compensation mechanism may restore pH level to normal of 7.4. So if acidosis is not compensated, the pH level falls, okay, and the patient may go into coma. That is dangerous. So this compensation by the kidney and the lungs must be immediate. If it does not happen, the person will go into coma. But when chronic metabolic acidosis cases are treated by administration of sodium lactate, what happens is that what you all know that from our previous class videos that sodium is present in blood plasma and hydrogen carbonate is present in blood plasma. That in that way they can form sodium hydrogen carbonate, in which the sodium hydrogen carbonate, it is more high in acid than carbonic acid. So at the end of form what? Salt and then weak acid, which is carbonic acid. Okay? that is how it continues. So that now the carbonic acid that is formed now can also go into circulation again, okay, by blowing up by CO2, and that is how it continues. Now we move to metabolic acidosis. Metabolic acidosis, it is rare, it is not very common, but it is due to more bicarbonate in plasma, okay, means bicarbonate alkaline is more in plasma. Then you can see we have metabolic acidosis, and the causes of it is excess loss of hydrochloric acid in the stomach or in the body over a prolonged time due to vomiting or whatsoever can lead to what? High alkaline content, which is the bicarbonate in plasma. And it's also occurring in pyloric obstructions. You have all heard of H. pylori before, okay? And also ingestion of salt. Ingestion of salt of IC like sodium lactate, okay? Now I have just explained it to you when you already know that a salt that contains bicarbonate, you are injecting it again, okay? So what happens? It will contribute to the ratio and it will be very high in plasma. Excess production and excretion of ammonia, okay? Excess production, you know that ammonia is already an alkaline. Ammonia is an alkaline, it's a base. But when you are producing it, and excess excretion means you did arrive it into balance, and you are producing it already, and the condition is compensated by this. So it will be very high in plasma. So pulmonary compensation mechanism. How can metabolic alkalosis be compensated? One of the reasons it can be compensated by what? Hypoventilation. Hypoventilation means the breathing is less. Okay? Hypoventilations. Respiratory rate is decreased. So the blowing up of CO2, okay, it will be less. And to accumulate plasma carbonic acid, okay. If the respiration of CO2 that blow up the CO2 carbonic acid from the system, if it is less, this acid will be built up to compensate this metabolic alkalosis. So we say at the same time, PDE compensates this alkalosis by what? By increasing elimination of HCO3 and decrease hydrogen ion excretions. This thing carefully. PDE can also compensate this alkalosis by what? Increasing elimination of HCO3 and decreasing hydrogen ion secretion. By combined action of this organ, the organ can level the blood pH to come to normal. So if the metabolic alkalosis is not compensated, it can make the body to develop and convulse seizure may occur in children. Okay, it makes the body to begin to develop seizure. Okay, that is how it is very important. So now we are looking at what? Respiratory acidosis. Okay, okay, now we are talking about respiratory acidosis, and this respiratory acidosis, it is due to more plasma of PCO, it means pressure carbon dioxide level, that can result to this respiratory acidosis. Now I want you to know that it's a combination of CO2 and water that form carbonic acid. So when CO2 is more, definitely there will be more acid in the system. That is what you can have respiratory acidosis. One of the examples again is the depression of respiration, means you are not breathing well. With a condition that we refer to hypoventilations, it can also contribute. And one of the things that can contribute for you not breathing well are in the case of dosage of morphine. There are some of you that like taking hard drugs or barbiturate and other respiratory depressants can contribute to you not breathing well. And when you are not breathing well, there will be more acidosis in the system. And another example is obstruction to air passage, like in the case of asthma, another related disease that can block the airway, that breathing will be difficult, can contribute to acid building up in the system. And then mainly, this renal mechanism compensate this condition by absorbing more. So if you want to compensate how the body is able to compensate this respiratory acidosis. To compensate this condition, one thing the body does is by what? Absorbing more HCO3, that is bicarbonate, absorbing this more alkaline, and eliminating these hydrogen ions and ammonia in urine. So when hydrogen ions and ammonia is eliminated through urine, and the bicarbonate is absorbed, now we have compensated respiratory acidosis. Now we move to respiratory alkalosis. Respiratory alkalosis is when the plasma level of pressure CO2 level is low. Okay, it means this is what results to carbonic acid. If the level is low in plasma, it can result to this respiratory alkalosis. And then in that case, one thing that can lead to making this level of carbon dioxide low, we can hyperventilation, in which you are breathing fast, breathing very, very fast. If you are breathing fast, you are blowing off all this CO2. And so when you are blowing off, it will be low, or stimulation of respiratory center. So the only way that this can happen when there is stimulation of respiratory center in the brain, that can lead to hyperventilation. So hyperventilation don't just occur. It occurs by the respiratory center being stimulated to breathe faster. That's what leads to what? Hyperventilation. And in such a case, a disease condition that hyperventilation can occur, it will occur in fever, head injury, anxieties, and all others. Okay? And then how can this respiratory alkalosis be compensated? One, kidney compensate this imbalance by what? Elimination of what? More HCO3. Here, we say absorbing it. Okay? You know, alkalosis is opposite acidosis. In acidosis, the kidney have to absorb this hydrogen carbonate. But in acidosis, the kidney have to absorb this hydrogen carbonate. While in alkalosis, the kidney have to eliminate it. Okay? So we move. Now look at this now. Laboratory diagnosis. Laboratory diagnosis of acid-base disturbance. Okay? The laboratory diagnosis of acid-base disturbance. Determination of this type of acidosis or alkalosis can be made by measuring plasma pH of. To listen carefully, laboratory diagnosis of acid-base disturbance. So we will be looking at determination of this type of acidosis and alkalosis using our plasma pH, pressure CO2, and HCO3. Okay, knowing the level of it, this in blood. Okay, this parameter, if you know the level of it in blood plasma, it will help you to diagnose some certain disease that is related to this condition. These are the normal range. The normal range of plasma pH is 7.4. You already know it. Then the normal range for plasma hydrogen carbonate is 25. The normal range for plasma pressure carbon dioxide is 40. And so these are the range for metabolic acidosis. Okay, if you carry out a test and the level of the plasma pH is within this, you can say it's metabolic acidosis this and it's that. And if it is higher, you can say metabolic acidosis, metabolic alkalosis. These are the regime, these are the levels for plasma hydrogen carbonate and plasma pressure CO2. Okay, thank you for listening, but I want you to know that we have come to the end of this class of biochemistry of hemostasis and looking at acid-base balance. And then we have almost about 4 videos, and I want you to watch it one after the others. We have almost about 6 videos. Okay, go for all of them and watch them one after the other. Okay, then looking at this, we should be able to define buffer, explain the action of buffer with example, We are able to write the Henderson-Hasbach equation and the important. Now you are able to explain the role of kidney in acid-base balance. Now you are able to name different type of acid-base balance disturbance. That's what we just did in this video. Now you are able to define metabolic acidosis and how is it compensated. We just finish it now. Now you are able to you'll be able now to write conditions that cause respiratory acidosis and what? Alkalosis. We just finished all this now. So thank you for giving your listening ear. Have a nice day. God bless you. We meet in class. Forward your question to class.